Good afternoon, my name is Daneil Brown. My team and I were called to a scene of a 32-year-old male who is suspected to have fallen from a ladder. My scene is safe. Number of patients is 1. Standard precaution has been taken by my team and I to include a face mask as well. I am suspecting spinal injury, so spinal precaution will be taken. I will need ALS intervention. My general impression of this patient, while I approach, I see an adult male laying prone, see no signs of movement. Sir, if you can hear me, please do not move your head. Caution, and I ask my partner to come and take over. Ready? I check again. Sir, can you hear me? The patient groans. Sir, I'm going to expose your back to do some checks. I cut away the patient's clothes. I am doing a quick rapid scan. Checking for abnormalities. I feel a bit of crepitus on the pelvis, so I'm suspecting pelvic injury. I'm going to do a quick auscultation while the patient is there. There is diminishing lung sounds on the right side. I have a partner to come, and we are going to log roll this. We're going to do a controlled log roll of this patient. And because I suspect pelvic injury, I am going to ask the bystander to come and take control of the board while my partner holds the pelvis to do a control turn. On your count.
1, 2, 3.
Alright, patient is now supine. I am now going to ask my partner now, who is holding C-spine, to do a jaw thrust maneuver to open the patient's airway. I am now going to look, listen, and feel. But before I do so, I'm going to check again. Sir, can you hear me? The patient groans again. So I'm looking and feel. There's nothing in the mouth. There's nothing in the mouth. So I am now going to do a quick check. There is no. I'm going to do a rapid scan. There is nothing coming from the ear. In the head. No signs of jugular vein distension, and no signs of tracheal deviation. I am now going to put on a C collar. C collar. I'm measuring, using my fingers to measure. I'm going to also do the same for the C collar and to find the correct size. I attach my C collar, and now I am moving on to my breathing. So I am checking. I see there is unequal rise and fall of the chest, but adequate depth on the left side, but the right side I'm suspecting a frail chest, because I see paradoxical movements of the chest. Patient is breathing at Patient is breathing at 8 breaths per minute. I'm I'm going to check for lung sounds again. Attaching my pulse oximeter. My pulse oximeter reading is at 100%, and I still hear diminishing lung sounds on the right side. I'm going to ask my partner to put on a nasal cannula at 2 liters per minute while I continue my checks. I am now moving on to circulation. Patient has a pulse rate of 136 beats per minute. It is weak, bilateral, and unregular. Sorry. Patient's skin condition is diaphoretic. Patient condition is diaphoretic, and there is no signs of cyanosis. Patient pulse, patient capillary refill is delayed. I am suspecting that this patient is showing signs of shock. I'll make a note, and I'll now move on to my rapid to do a quick rapid scan of this patient. Still taking note of the frail chest, and I'll do my precautions. Thing. Go around my partner. Go around my partner, and I'm checking. No. I'm exposing the right leg. I see deformity, obviously deformity on the right leg. I am suspecting a closed fracture. I'm taking a note, and I am checking PMS. The Daneil PDS is weak. There's a pulse, but it's weak. Exposing the left leg, and there is no signs of deformity. There is a pulse, it's also weak, and at this moment now I am going to use a sheet to put under the patient to secure the pelvis, and then ask my partner to let go of the pelvis because I have now secured the pelvis. I am going to use a soft sheet or sponge to put in between the patient's leg, and the patient is already secured on the spine board, and I'm going to use this to secure both legs together and straps the patient. At this point in time, this patient is now a load and go. The patient is an emergency case, it's a load and go. I'm going to now put the patient inside the back of the ambulance while I get a sample history from the bystander. The bystander reported that this patient is known to be diabetic. He was diagnosed about 2 years ago, but he knows that he is not taking his medication. With that in mind, I take that as a note. The last time he ate was about 6:30 this morning. It's now after 3 in the evening. So I am going to ask my partner now to do a full set of vitals, to include pupil reaction, a new set of respiration, pulse, and in the back of the ambulance I'm going to do a focus assessment to find out if there's any other damages that I have missed, and I will also treat for shock. I will use the blanket to cover the patient, and And with the vitals, I will call medical control to find out the location of ALS. I will reassess this patient every 5 minutes, as this patient is now a priority case. I will reassess every 5 minutes, and I will until either ALS have intervened or I reach to the hospital. Thank you.